Welcome everyone. We're so glad you're joining us today. We have a special friend with us. This is Paige Sims. She is a physical therapist and she specializes in breast cancer physical therapy. And so she's become a very, very dear friend to us. We partner together on a lot of different things, and we asked her just to be with us today just to give us some basics on why you need physical therapy. I know a lot of times none of us are even told that we need physical therapy until after the fact or until we're having problems. And so we want to just help you guys understand the benefits of physical therapy and when you need to get involved. So kind of let's start there. Tell us when should we get involved with our physical therapy?
I would say as soon as you get your cancer diagnosis, that just needs to be in your head that rehab needs to be a part of your journey, because that's going to really you're going to be proactive about things, and a lot of side effects are going to be avoided if you can have physical therapy involved. I treat women throughout the whole journey, so if they are seen before, we can get it's called a prehab evaluation, and we can get baseline measurements. So I would know, Sarah, like what your range of motion was before you even had surgery or chemo or radiation. So we know exactly, did you have some shoulder problems before, or was your range of motion perfect? How was your posture before? How was your strength before? So that's just a one-time visit, and it's a really great visit on educating also, like right after surgery, how should you be moving? And here's some exercises you can do right after surgery. You don't need to be pushing things. Your body's going to have inflammation from surgery. Let that happen. That's fine. That's normal. It kind of takes away the fears too, because you've had this conversation before everything's rolling.
Yeah.
And then, a couple weeks after surgery, when everything's healing up and there's no open wounds or drains, then come back in and let's start, working with you and making sure that things are, that you're not afraid and you know what you're doing. But if that hasn't happened, then it's never too late either. I just had a lady the other day. She was diagnosed in 2005, never really had physical therapy. No one really said anything to her. Then she was had reoccurrence in 2015 and 2017, and now here she is with me, and it's not too late. But it's really sad because now she has pitting edema in her arm, because nobody sent her, and she would have never had to have all these side effects had she had physical therapy early on.
Well, that was totally me. I came to see you way after the fact, years later, and I had so much scar tissue that you had to work on, and it takes time as well. What about though if you don't have to have surgery? Should you still go to physical therapy?
So chemotherapy, I feel like there's just not a lot of education. The doctors are just trying to do what they need to do to make sure you're getting through this and that you're surviving the cancer and the cancer's gone. But so if you've had adriamycin is a cardiotoxic drug, so it's affecting your heart. So if you're not aware of that, you can have damage. So even this other lady I had this week, she didn't know really what it was affecting her heart, and so her ejection fraction got down to 30%. So now they're just trying to get it back to 50%. But had she had physical therapy, we could have been making sure that she knew what her heart rate should be the whole time she's exercising.
Yeah.
And we can really make sure she's being safe the whole time during chemotherapy. And then we have specific things in place to let the patient know, like, this is how we keep you safe during chemotherapy. And then after chemotherapy, this is how your heart rate can get, we can get you back to a safe. So there's just a lot of things like that. Or if you're on Taxol, that taxes the peripheral nervous system. So then you may have, neuropathy going on. So how can we help with that? And how can we make sure that we're doing the best to minimize that, if that's affecting balance. And so there's just a lot of things, even if it's just chemotherapy, or even some people will, I just had a lumpectomy. Well, just a lumpectomy, it's still, there's still scar tissue in the area, then some lymph nodes were removed, so all of that is impacting your lymphatic system, so you don't do anything about it, and then bam, 2 years later, you're starting to realize you're having heaviness in your arm, and it used to just be in your breast. So it all matters, and it all starts to add up, and so it really best if you just even come for a few visits and get education and know what's going on with your body.
And again, this is so important. That's why we talk about it so often, because the majority of the patients that we see, this is not being discussed in any kind of oncology appointments. And it's frustrating as a patient because everybody's not working together and it's not really a holistic approach. Now, what should they do if they're listening to this and they're like, I need that? What steps should they take?
Yeah. So you can either, if you know a physical therapist that's working on, these kind of things and you've heard of some, you can just go and call and get an appointment. A lot of places are direct access now. A lot of states are direct access. And so that physical therapist can evaluate you and then send the evaluation to your oncologist or your plastic surgeon, and that can be just fine. Or just call one of your doctors and ask for a referral to physical therapy, and they're going to be happy to do it because you're asking for it and you're saying that you think it could be helpful to you.
So they just call their oncologist or call their PCP, whomever.
Yes.
And if you're in the Oklahoma City area, obviously you can call Paige. She is with Restore Physical Therapy. And we can give you guys the contact information for her. Now, let's talk about you want to show them some basic stretches maybe that I can do? I know for me, my side. She's worked on me a lot. Yeah. But I get a lot of tightness on this side. So do you want me to lay down?
Yeah, so a main complaint is a lot of truncal swelling or tightness. So I'm going to give Sarah a pillow. So a nice stretch that you can do is called the chicken wing. So you're going to put your hands behind your head. Mm-hmm. Now, if you're not ready for this stretch yet, and right here I would just ask Sarah if she's in the clinic, Sarah, 0 to 10, how much discomfort are you having with this stretch? And if Sarah tells me I'm a 6 or 7 just doing this, then I'm going to have her start with her hands on her forehead because she's already telling me this is too much for her. Okay. So then Sarah would go ahead and you'd move your hands to there, and that's where she'd start because she's too tight. So Sarah would just start with just going from here, and then I would just tell her to take herself to a 3 or 4, and then she would take 2 deep breaths. Now the deep breaths are important because I need her ribs and her diaphragm to be fully expanding and inhaling and exhaling when she does that. And because what happens, the lymphatic system moves with muscle contraction and deep breathing. Yeah. And so since Sarah can handle it, she's going to go ahead and put her hands back behind her head. And so Sarah's going to probably tell me your discomfort is 0. Yeah. So when she says 0, I'm going to let her go ahead and stay there. And I'm going to let her bend her knees up. And because we want so much going on through the abdominal area, I'm going to let her go ahead and move her knees to the side. And she's going to take her 2 breaths that way. So now what we're getting is a full stretch diagonally. And we're getting rotation through the low back. We're getting rib cage movement. And then after her 2 breaths, she's going to rotate to the other side. Yeah. So if you're to this point, this is great. Now she's getting ribs are moving. Again, she's getting diaphragmatic breathing. And that's a great exercise. Okay. You can come back down from that. So that's a huge thing that we miss. When we've had surgery, people want to think, oh, it's no big deal. Like I'm going to move on with life. And it's like, you just had 2 body parts removed. Your ribs have been impacted. Your clavicle, your shoulders have been impacted. Your diaphragm's been impacted. I'll get ladies in here that can't even breathe anymore. So then if you can't even have a deep breath, you definitely can't move your lymphatic system. Yeah. So this exercise alone is huge.
Well, okay, now not to mention reconstruction patients, deep flaps and lat flaps. So Jane's here with us too. So Jane and I have had lat flaps, and we're moving muscles around, and all the challenges that we face with, compromising here, and now like capsular contracture, all the things. Yeah. So what are some things that we can do?
Yeah. So another thing is a lot of patients will be like, yeah, I move just fine. I don't need physical therapy. Well, then you'll get somebody on the table and you're like, do you really move just fine? Like, can you really get your arm all the way to the table? And can I keep it on the table? And can I get it all the way up to your ear? So I would take this pillow away from Sarah and really see, can I really keep her arm on the table? And she can. But most of my patients, they can't. Yeah, so let's even just try
this is the lat flap side.
Yeah. So on this side,
I know it's tight.
I've got it on the table. And I'm starting to feel. So she's feeling pretty uncomfortable right there. Yeah. But most of patients, they don't realize, but they'll be way up here. Like I'm saying, no, you're not on the table. You're not on the table. And so what's going on is if we can't get full motion, and we've got lymph nodes removed here, we've got scar tissue here, and we don't have range of motion, now you've got this huge impact, and the lymphatic system cannot clear. And then you start to get congestion, then you start to get cording. So if you can get a therapist that can come in here and work the scar tissue, and I would get Sarah in a gown, I will literally be on her skin, and I'm working the scar tissue, and then I'm working the range, and we get all that range of motion. you start to get flow, and it is tremendous. It helps so much, and a patient will leave here and go, I did not know my arm and my breast could feel this light. And it makes a really big difference. So that's just kind of some basics.
Right.
Another thing is, I would go ahead and have you sit up. Watch out for that. Is the biggest exercise that I would have anybody do that's had lymph nodes removed is called the bye-bye.
Oh, yes, I do these all the time.
So it's just saying bye-bye to that lymphatic fluid, and you would do 3 forward, and you just bring the arm down, and then you would do 3 to the side, Sarah. And you go all the way up. Deep breaths, too, is huge. Yeah, deep breath, and she would do 3 to the side. So it's important to do the motion, but also get that deep breath and that elongation. Yeah, good. Yeah. And so what's happening there is her lymphatic fluid is moving, and what we want, it's coming down to the spine, and we have spinal lymph nodes.
That's good.
So we want these lymph nodes to process because her axillary lymph nodes were impacted. Okay? And I'll have patients tell me, I can feel the fluid. Some people will say, I can feel it. It feels like it's rushing down.
Feels like water.
Yeah, it feels like water. Yeah, and they'll go, is that weird? And I'll go, nope, that's not weird. That's what we want. Yeah.
I feel a cooling sensation, like when she starts to stimulate the lymph nodes, and I can tell when my arm gets heavy or it'll start to get a little bit tender, and I'll just start to do my bye-byes, and that's a quick way to get it to move. And it really does help. It sounds so simple, but it works. But if you have more extensive pain or swelling, that's definitely an indication that you need to come see somebody. And I know Paige, like when you go see her, she'll work with you on the table, but then she takes you out in the gym and she'll teach you exercises to be able to continue to build strength, continue to move the fluid, and we just don't realize how much it really does impact us. Even like she said, you think you're moving, but maybe you're not having full mobility. And so it's worth a visit. Even if you come and she says, yeah, you're good, keep doing what you're doing, especially if you're an active person already. But I'm just realizing, especially the older I get, and I'm not even that old yet, but the impact of this on our bodies long term it's hard, and it can be very immobilizing. And it's maintenance. Like, we have to continue to work on our bodies because scar tissue builds, it thickens, depending on what kind of surgeries you've had. I mean, I know
something a lot of people don't know is if you have had radiation fibrosis happens. They're saying 3 to 5 years, but now I just took a course again, a 4-day course, and they're saying for 10 years after radiation. So I'll hear patients going, oh my gosh, I still feel that I'm tightening, and because it's happening. That's what's happening. So unless you're just on top of it, you really are still having tightness from radiation. So it is important to stay on top of it. And I think too, don't think this is my new normal or this is how I'm supposed to feel. Like, that's my word. I hate hearing that because 100% of my patient load is breast cancer survivors, and I can't tell you the amount of people I'll see that say, I feel better after coming here than I ever felt before my cancer diagnosis. And that's because they didn't know they could feel this good. They didn't know. But, it's just, you don't have to feel bad. You don't have to, feel weak. You can, your body wants to heal. That's the nice thing. And that's something that I think that the doctors don't tell you and that people don't realize, but our lymphatic system can heal. The old school way of lymphatic therapy was do a lot of bandaging, a lot of compression. That's just the only way you can do. But then the newer way is that our lymphatic system has been impacted, and our transport capacity, the way we transport, has been impacted from scar tissue surgery. Now it's down here on the floor, kind of. And this is where it used to be. But our system does want to heal, and it can heal. It needs help. And so with the physical therapy and with manual lymphatic drainage and help, we're treating the body and teaching the body, we can do this. My other lymph nodes can optimize and get efficient and effective again. And it's amazing. I was just seeing a lady yesterday. She's only come for 3 or 4 visits. So the first visit I treated her, she said, yeah, my arm and breast felt lighter for, I think she said maybe an evening, maybe 24 hours. And then it was the 3rd visit. She goes, I almost went a whole week. And everything felt better. I said, because her system's already learning that fast.
That's awesome.
And our bodies can learn and wants to learn. So we don't have to just bandage and just think this is my life.
Yeah.
Yeah.
And that's what I love about Paige. She's proactive, and she helps you overcome fear, because I have a lot of fear personally with movement and pain. And so she's helped me a lot just to try to overcome that and to know that I can do it. And so tell them how they can reach you.
So my website is www.restorept.me. That's my website. And then our phone number, is that okay?
Go ahead, yeah.
Is 405-285-4017. And you can just call and schedule an appointment with us. And we would love to see you and help any way we can.
Yep. So we just want to encourage you guys, if you haven't seen a physical therapist, we want you to get out there and at least get an assessment and see if it can help you get moving. Yeah. So thank you for being with us. We appreciate it. So we'll talk to you guys soon.